Hi everyone, and welcome to your month 2 presentation where I'll be talking about the relevance and importance of muscle strength when it comes to lower back pain prevention and treatment. So let's have a quick look at the inner core first, and I'm sure you've, through your research of your back pain, you've more than likely come across this anatomical term called the inner core. And this is a term used to describe the four muscles on the left-hand side diagram. And these four muscles act as a bit of a barrel in the centre of the body to provide support and stability. However, the importance of these muscles has always been, extremely exaggerated within back pain treatment. And recent evidence supports the notion that weak inner core muscles are definitely not a major cause of lower back pain, and that we should not really be focusing on trying to strengthen them to treat lower back pain. And yet this is not widely known or really advertised by healthcare professionals. It's a bit of a myth, such as like carrots don't make you better able to see in the dark. And in fact, the vast majority of back pain clients that I see, they tend to have very overactive, so quite taut and tensed up and active inner core and surrounding muscles, leading to them becoming very stiff and rigid. And generally this is because they are experiencing back pain, and therefore they want to avoid movement to avoid any more pain that movement brings on. And this leads to all the muscles around the spine, tensing up just to try to prevent any movement. And this has a knock-on effect of reduced movement, increased stiffness and tightness, and then more pain, as the right-hand side diagram illustrates. It's not a comfortable thing to be constantly taut, rigid, and clenched up. And this is why continued and consistent movement, even when mild to moderately painful, is so important. And this is why our exercise classes are not focusing on strengthening the inner core muscles. Instead, we want to be strengthening all the muscles which surround the spine and pelvis. And here's why. So as we can see in the left-hand side diagram, a tilting of the pelvis can change the biomechanics of the spine, so how our spine moves, and it becomes excessively curved in the lower spinal area, which places much more stress and load going through our lower back. And this is all coming from the relative tilt of our pelvis. So you can try this out now in sitting or standing. And if you imagine that your pelvis is a bucket of water, and if you pour the water out from the front of your bucket by tilting your pelvis forwards, you will notice that your lower back increases its curve. But now if you pour the water from the back of the bucket by tilting the pelvis back, you will notice the curve on your lower back reduces. And so from this we can see that the muscles which act on tilting the pelvis play a large role in the movement, the stability and support of our lower back. And this is why they are so important, and what we're going to be focusing on strengthening throughout your strength classes in month 2 and 3. And it's these muscles on the right hand side of the diagram, namely, the glutes, the thigh muscles, the abs and the lower back muscles. But of course it's not just the strengthening of these muscles which enable the pelvic tilt motion, which will, treat your back pain. It's definitely much more to do with the increases in strength and the more resilience and endurance and muscle power we have in our muscles. It leads to them being more able to cope with the demands of everyday life. And I'll be talking a bit more about that in a few slides. But so we know that all of these muscles which surround the spine and pelvis are important for the stability and movement control of the tilting of the pelvis and the knock-on effect of the movement on the spine. And as the diagram on the left shows, tightness or weakness in particular muscles can predispose our body to move in a particular way, which may change the biomechanics of our spine, how it moves. Or, the way our spine moves may predispose our lower back to injury. And so by strengthening our surrounding muscles, we provide our body with sufficient support and stability to be able to cope with the demands we place upon it. And this is why strengthening is so important. With all the bending, the lifting, the carrying, the pulling, and all other movements we do from day to day that we don't necessarily think about, and this could be anything from carrying heavy shopping or carrying the Hoover upstairs to lifting a heavy plant pot to move it. If our muscles aren't strong enough to cope with the daily activities we put our body through, our muscles will eventually give out on us. They'll become sore and achy and therefore more prone to injury. And I'd say commonly when I see a back pain client, they'll say that their back went into spasm, or it went when bending down to pick a small light object off the floor, or maybe when twisting to put the seatbelt on. And while it was maybe this event that triggered their back pain episode, it's much more common and likely than not that a heavy, unaccustomed activity such as maybe gardening or some DIY or filling a skip a few days beforehand made their back a bit achy and sore, and it was just a mundane task of putting the seatbelt on which tipped their back over the edge into that pain threshold. And so, the stronger our muscles are, the more robust and resilient they become, and the more able they are at coping with the demands of everyday life, which eventually or does lead to a reduced risk of injury. And this is why muscle strength exercise is the absolute sort of holy grail for anyone suffering with musculoskeletal pain, and whether that would be back pain or arthritis or running injury or plantar fasciitis, you name it, muscle strength exercise is the absolute key for prevention, management, and treatment of essentially the vast majority, if not all, of these musculoskeletal pains. And so we briefly discussed about why strength exercise is so important. So a bit now onto how we actually strengthen our muscles to reap the benefits from them. And so far throughout this course, you've been completing daily sort of mobility, stretch and release classes with also a daily step count to achieve. And while these are all amazing forms of exercise and the management of back pain, they aren't necessarily effective in strengthening our muscles in order to treat it. And the best way to strengthen our muscles is to complete resistance exercise. And whether that be bodyweight exercise or using equipment such as resistance bands or weights. And this is why we have included these twice weekly strength focused classes into your weekly timetables. And so, how actually does strength exercise lead to us becoming stronger? Well, every day our muscles are constantly undergoing a process called muscle protein synthesis. And this is basically just the breakdown of muscle tissue whilst replacing it with new muscle tissue, similar to what happens with our skin cells. And a pretty cool fact is, of all the muscles in the forearm, over a 6-week period, all the muscle is broken down and replaced with new muscle every 6 weeks. So it happens on quite a fast pace, and this muscle protein synthesis is continually happening 24/7. So, and when we engage in strength exercise, it's this muscle protein synthesis production that gets massively stimulated, meaning that we put on much more muscle than was being replaced. And this leads to a net increase in muscle mass and therefore muscle size and strength. And it's not only strength exercise that is essential for people of all ages, but it actually becomes even more important as we age. And the reason being is that as we age, we undergo a scientific term called sarcopenia. And this term means the gradual loss of muscle tissue due to the normal aging process. So as we get older, unsurprisingly, we gradually lose muscle and become less strong, less robust and less resilient, and therefore more prone to the general aches and pains, and of course the prevalence of back pain. And the graphic on the left illustrates how the combination of aging and inactivity, in particular strength exercise, leads to a loss of muscle cells, leading to weakened muscles. But also, the woman on the right deadlifting heavy weights just goes to show that it's perfectly normal for anyone to do, whatever age, gender, or experience level, because it's absolutely essential to keep us strong and healthy. And so, this sarcopenia is not inevitable. Just engaging in strength-based exercise twice per week is enough to stimulate the muscle-building proteins to not only maintain but actually increase your muscle mass. And as the graph on the right shows, it's this strength-based exercise in accompaniment with good nutrition, in particular a high-protein diet, which leads to the best prevention of this sarcopenia. And so the importance of strength exercise is clear as day, but which type of exercise is best? Well, as we mentioned earlier, strength exercise requires the use of resistance exercise, maybe using our body weight or resistance equipment such as TheraBands or weights to provide the necessary resistance that our muscles must overcome to then make them stronger. And so whether you complete bodyweight exercise by doing strength-focused Pilates, or a home workout using resistance bands, or head to Decathlon to buy some light weights to begin some weight training, or wait till you're able to head back to the gym to get stuck into some weights there, I'd say the most important decision is to do what you feel most comfortable and able to fit into your weekly routine, whilst also getting the most enjoyment and satisfaction from it, as with strength exercise, the consistency is key. And the reason being is that it takes many months to build up a good foundation of results from strength training, but it takes a lot less time for these results to diminish without continued strengthening. So we really need to be consistent and routine with it. And so, of course, doing what we enjoy the most is the best way forward. And so throughout this 90-day course, what we've been doing is introducing you to some strength-based bodyweight exercise just to get you started on your strengthening journey. And this is a type of strength exercise that is highly recommended for people with back pain, and it's a very viable and great choice of strength exercise that you can continue to do at home way into the future, past the end of this 90-day course. But going beyond this 90-day course, there's a principle of strength exercise which is really important to understand and implement into your strengthening exercise routine. And this term is called progressive overload. And this means that over time we progressively overload our muscles so that we continue to make them bigger, stronger, more robust and resilient. And the arrow diagram gives an example of what this progressive overload looks like. So we're starting off now with bodyweight exercise, but we want to eventually progress to resistance-based exercise so that we progressively overload our muscles and then onto weighted exercise using maybe kettlebells, for example. And this progressive overload principle is so important. If we just continue with the same old and don't progress by increasing resistance, our muscles will just plateau and we will not reap the benefits from them. So, it's essentially the same as maybe starting the NHS's Couch to 5K running program. You start on week 1, but then you never progress to week 2 and beyond. So we need to continually increase the resistance of our strength exercise over time as we would progress through the weeks on this Couch to 5K, so that we run a further distance and therefore progressively overload our running capability. So I hope you found this presentation interesting and hopefully start to understand how imperative strength training is in the treatment of back pain and some of the principles that you need to adopt after this 90-day course in terms of continually progressively overloading your weight training and muscles. And I'd say, as a physio, if I had like a gun to my head in choosing what I think I would advise for someone with back pain in terms of treatment, it would 100% be to regularly complete strength exercise. And so, good luck with this week's exercise classes, and I look forward to seeing you next time.